Targeted violence, including criminal extremism, is a threat affecting the whole nation. Active service members and military family members are not immune from the threat as targets or as perpetrators. This concerns everyone, the veteran community, all Americans, and the world. It is our responsibility to collectively take steps to prevent targeted violence. Luckily, there are mitigation strategies that can be adopted to help prevent targeted violence within the military community. One mitigation strategy is to adopt a public health model, which can be implemented by the military community to address targeted violence and extremism in the ranks. The public health model, commonly adopted as a model for preventing any number of public health concerns, is a comprehensive approach to preventing targeted violence that envisions building thriving communities and individuals resilient to violence, and by extension, violent extremism. Applying the public health model should begin with the active military. Targeting receptive audiences with prevention education at all points in their professional military experience is a more effective long-term strategy for mitigating extremism in the armed forces than simply targeting the problem at the point of entry. There are 4 main objectives involved in this strategy. Initiation to this approach during entry-level training and inoculation, continuing education throughout service, building organizational culture, non-punitive responses to reporting and dealing with extremism, and incentivizing bystander prevention, and fostering strong educational and public advocacy partnerships between the DoD, the VA, and community-based organizations. Implemented strategies should focus on strengthening efforts to combat the recruitment of service members and veterans into violent extremism through inoculation training, and providing service members the tools they need to identify and effectively resist extremist manipulation tactics and their use of mis, dis, and malinformation, or MDM. While prevention programs are a hallmark of public health models, interventions and treatment play important roles as well. Military separations should not be used as a quick fix to transfer risk out of the military and to law enforcement. When military separations are used to counter extremism in the ranks, it is suggested that they be paired with referrals for rehabilitation services, and that risks to community safety be effectively communicated to law enforcement partners. Further, the armed services should implement strategies to help military members transition into the community after they leave active duty. The Transition Assistance Program can help by providing civic education and showcasing local paid and volunteer civic opportunities as a central feature of transition services. Finally, the public health model also focuses on building and maintaining strong partnerships with military service organizations by pairing efforts to identify and disrupt already radicalized service members with investments in military family-led prevention programs. Empowering military family service organizations, or MSOs, to build on the individual, family, and community-level protective factors available to military families, with a specific intent to increase positive civic engagement and to crowd out risk factors related to violent extremism and related mis, dis, and malinformation. Creating a prevention network that includes the MSOs and community partners to raise awareness of the threat of extremist recruitment of individuals with military service backgrounds, and investing in programs that help the MSOs and community partners assist individuals at risk of radicalization by connecting them with physical, mental, and economic health and wellness support programs. Adopting a public health model to targeted violence prevention across a wide range of activities throughout a person's entire military career is a comprehensive strategy that has the potential to affect meaningful change. It also provides many opportunities for the armed services, members of the military community, and those that serve them to become involved. Whether helping a friend at risk, participating in bystander training, volunteering for programs that help build community protective factors, working in service organizations to provide prevention or intervention services, or advocating for adoption of prevention strategies by the Department of Defense to help active military members, you can be part of the solution and help prevent targeted violence. To protect each other and the community at large against targeted violence, we must use our relationships and connections to find each other, support each other, and lift each other up.